share some of the herbal experience of how to use herbs for chronic constipation. I'm Dr. Ding. Um, Okay, this is my CV. If you are interested in my background, you can check it later. We're not waste of time to just. My background is like an MD doctor in China and also integrative medicine for colon rectal surgeons. Also specialize in pelvic floor disorders. So constipation actually that's very common in China, also here. So I choose this topic today. My outline we have like 5 things to do. One thing is understand the chronic constipation. The second thing, how the herbs works for the chronic constipation, because it's we want to integrative like Western medicine and Chinese medicine. So it's very important to understanding the chronic constipation. And also, even we use the herbs, it works well, but that still have the safety consideration and the precautions. So that's also very important. And the next, I will share a case study, and then we Q&A. Okay, let's see what is chronic constipation. Actually, chronic constipation, it's like very broad of the things, put something together, functional symptoms and disease, and also underlying cause from organic disorders, overlapping, or medication. Some kind of medications, for example, like mental disorders, and also painkillers, so many things, calcium. So for the chronic constipation actually has multifactorial etiologies. If we face on a constipation patient, actually the reasons is very complex. So we have to know a lot of things to figure out what's the chronic constipation. It affects individuals of all ages, especially elderly. Right now, the society is aging, so a lot of people actually have these issues. In the US, the prevalence is 90% to 20%. It's shocking that 60 Americans with constipation have never discussed their symptoms with a healthcare provider. They are mainly rely on over-the-counter medications. So when we go to the Target, go to the Walmart, Walgreens, we always see that there like a counter. There are so many things like stool softener, Senna, like dog locks. That's a lot of things that actually have so many side effects. For the impact of the chronic constipation, it seriously affects the quality of life of patients physically and mentally. For the healthcare system, also for the patient's family, there are very high financial burden. In the US alone, annual cost of purchasing laxative beyond 800 million. 20 to 30 of individuals aged 60 overtake laxatives at least once a week. So it's very high risk of heart attack. People we may don't know. Also, other things for the side effect from the so many kind of laxatives. So let's see the symptoms. We are very familiar with the constipation concept of reduced frequency of bowel movement. Hard stool, we know that's the constipation. Actually, more than half of the symptoms that patients have soft stool, but they still need excessive straining, incomplete evacuation, sensation of anal rectal blockage, and some patients need anal digitation, lack and rely on the laxative or even enema every day. So it's kind of, we have some different patterns. One is lack of the sensation to go to the bowel movement. The other pattern is have the sensation, but difficult to come out. So let's see the patterns from the Western medicine side. They have the 3 categories. One is slow transit constipation that related to reduce the times for the bowel movement. The second category, that's obstructive defecation syndrome. That's a reason that's related to the pelvic floor area, the muscle, ligament, nerves, sensation, reflex, pelvic floor organ prolapse, so many things, psychologically things. So this is kind of the second category. The third category, that's we are very familiar with, like many people have that symptoms, like irritable bowel syndrome. Some people may on the constipation side, some people may on the diarrhea side, or some for the cramping. So these are three main categories from the Western medicine side. But we have to exclude the red flag. For example, like rectal cancer, colon cancer, or some like other things. So how can we diagnose this? Usually we diagnose it from the symptoms and exclude the like organic mechanism, the reasons. So then if we think that's a benign issue, how to know and how to have the different patterns. For example, like STC, we call it slow transit constipation. Patient usually no sensation to go, slow motility. Even some of the patient maybe every 2 weeks. Some patient maybe even 1 month. For the ODS, patient have the sensation, even urge to go many times a day, but they are in complete evacuation. They have normal transit. So like these kind of patients actually very common, but patients don't know, so they are overused laxative. That make the things worse. The third category, that's IBS-C. These kind of patients, after the bowel movement, their symptom can release. They also have normal transit time. So these kind of categories can mix together. Like STC can combine ODS, can also combine with IBS-C in the same patient. So usually if in the clinic, we always ask the patient, what's your stool looks like? Like in the right side, we can see the idea is the sausage-like and smooth. So for the slow transit constipation, some of patients may have like separate hard lumps, also like very hard. Some of the patients, they have the constipation and they use the medication. The poop were like this, muddy or even liquid, but some of them, they still hard to expel. So in recent 30 years, for the functional GI disorder, their research really focused on the gut-brain axis. Recent 15 years, they are more focused on the media. That's what's the media of the gut-brain axis? That's the bacteria. So it's bacteria. It's like our body's internal environment. This brain-gut biodirection interaction, if we understand this is very, very important to help us to know what's the constipation and how can we deal with that. For example, like stress. Stress can be trigger for the brain, and will have the psychological disorders, something were related to have like different level, to have the bad message to the gut. So there are the poor gut bacteria not balanced. So that will be difficult to have the chronic constipation. So usually like this. So today our topic is for the herbs. The herbs, actually the herb intervention, actually will try to change the bacteria, the internal environment. So from different level, from nerve, from endurance and immune, that's a different level. Also, we also have like acupuncture. Acupuncture more focus on actually the nerve system. Yeah, so some from different like breakthrough to change the environment. So next we move to the herbs for chronic constipation. We use herbal medicine because if we want to use the herbs very well, we have to know the traditional Chinese medicine diagnosis. We use herbs, we can use raw herb, we can use granules, we can use tea pills or capsules. That's just the tools. It's really depend on how severe the patient and what the patient prefer or what you can cover that. Usually the raw herbs it's better. Granule, it's easy to take. Tea pills, that's for chronic things. That's also patient like that. Why we use herbs? Actually, herbal medicine offers a multi-target approaches. It's not only related to disease, also for the health. It's different from the Western medicine medication. They are usually target one receptors. So the herbs can providing individualized treatment for the different patient. We have to match patient's body constitution. What's the body constitution? Later we will cover that. So it's for the patient. Actually, we can use food. We can use single herbs. We can also use the formula. We can customize. So it's dynamic and flexible. It's also we can use orally. We can also use externally. So it's also for the patients, like the patients can't have the release from the conventional medication. It's the alternative. So if we want to use the herbs very well, we have to know TCM diagnosis. We have to get the patterns. What's the TCM diagnosis? We have 4: observation, listening and smelling, inquiring, and palpitation. For the constipation, usually I prefer the tongue, like more focus on the tongue. Why? Because the tongue, the coding, it's give us so many information. One thing, it's like the shape, the coding. It's like the mirror as our internal, like the bacteria. It's also easy to get the information virtually. For example, if we want to have like virtual herb consultation, we can only use the tongue to get the data, so then we can give them the herbs because we can't have the pulse, right? And also when the patient come to our clinic, we also have to pay attention to patient's body and mind, the status. Is it like energy? What's the energy level? Is it down, or it's like some face color or something like this? Our feeling, what kind of observation? It's actually that's very important. And also when patients sit down, we will inquire. We inquire the when and the how is the like constipation. What's the bowel related issues? The appetite, the diet, what's the sleeping issue? Because most of the patient, above 60% of the constipation patients have the insomnia because they have very high stressful and also bring gut issues. So we from the sleeping, we can know what's the patient's like mental relationship. And also for the female, we have to ask her the mens because it's also very important. It's like a mirror to know the patient's like the hormone level. Yeah. So then we will have the patient palpitation if we're face to face. Palpitation pulse, also very important palpitation in the abdominal. Because if we touch the abdominal, we can feel the tension from the upper GI or from lower GI, left or right or low. So we can know what's the blockage, like usually do. Where is the like constipation mostly related? Ascending or descending or sigmoid or rectal? Yeah. Some of the pelvic floor issues patients, we may do digital examination, but it's we have to get the consent from the patient. Because that's we can test the muscle tone, also the sensation, and also test is it the muscle can relax very well? Is it paradoxical? Something like this. So we know what's the main issue. Is it from the pelvic floor or it's from the motility? Yeah. So this is a kind of the what I do through the TCM diagnosis. So I mentioned that I'm more focused on the tongue because it is very important for the tongue observation. We use the herbs to change, to rebuild gut ecosystem. Through this, we ask the patient, and we also double check the tongue. Then we can reconfigure each patient's body constitution. We can from their shape, the color, the coding, etc. So different tongue characteristics reflect distinct body constitution. It's very, very important. So all these pictures from my research, all from the constipation patients, shows different body constitution. Yeah, later we will cover these different tongues. Okay, then we move to another concept that's maybe new, but maybe not new, but that's a recent research since 1970s from China. That's the body constitution, because actually different people have different figure. For example, like tall or thin, or obesity or full, that's a different. Or you may easy to feel cold, feel warm, right? That's genetically. So it's like your baseline. That's your body constitution. And we can from the tongue shape, that's a shape that's a thick or thin, small or full, red or pale, that's we can understand what's the body constitution, like the baseline of the patient. So it's actually, that's not new, but developed in the 1970s, express the principle behind the Chinese medicine and the individual treatment, and provide the corresponding methods. So that theory is actually, that's important. So in China, we have the already standardized these questionnaires to collect that. For the Chinese population, we have 9 categories based on the classification criteria. So if you are interested, you can check these papers from Wang Qi from China. So there are 9 categories of peaceful, that's normal, then qi deficiency, yang deficiency, yin deficiency, phlegm dampness, damp heat, blood stasis, qi stagnation, instinct constitution. So these are 9 constitutions. So usually we send the questionnaire to the patient, then we, according to their feedback, then we can know what's the body constitution of the patient. So then we can easily understand, because the herbs actually, we are focused on the changed environment, but the baseline is body constitution. So that's little by little, actually we are changing their body constitution. Let's see some patterns. Just now we mentioned the tongue. So I had a lot of research about constitution, about constipation for almost 20 years. So we have already had research about what kind of popular patterns for the constipation, chronic constipation. The first one, I think, that's the liver and the spleen disharmony and the qi stagnation. I think in China, also in here, for not very severe patients, usually this is a domain. Patients usually have a sensitive body and mind, easy to have allergy. So we can see from the tongue, we can see that almost normal, but that's kind of thin. So usually, if for food, for some juice or for some tea, we can use玫瑰花, like rose tea, right? Rose flower tea, something like this to for liver stagnation, liver qi stagnation. Yeah. If for the herbs, the most important herbs, that's chaihu and baishao, right? That's for the liver. Yeah. And for the formula, that's the chaihu shugan tang. So I checked this from the American Dragon. So I think that will be easy. You can check later. You just only to know the name, the formula name. So you can, according to the patient's issue, you can from this formula firstly, then according to the patient feedback, you can customize, add something, right? So for the chaihu shugan tang, that's like chaihu, baishao, zhike, Chenpi, right? Xiangfu, that's all for the stagnation and the liver qi stagnation. So this is a very popular used here also. It's very good for motility and also for the IBS-C type. Okay, then let's see the second pattern. That's a yin deficiency. Yin deficiency, we can see the liver yin and the kidney yin deficiency, and with some heat or without heat, but usually with heat. This kind of patient usually for the female menopause duration. So If just for the liver yin deficiency or stomach yin deficiency, we can use 针叶汤. Only use 针叶汤. It also works well for like a mild constipation, like very dry. Patient always feel like dry mouth. You can see from the tongue have some like thin, like lack of coating and some cracks there, right? A little bit like red side, right? So we can use 针叶汤. In 针叶汤, that's have like 玄参, 生地, and 麦冬. So this is a very good formula. And for the menopause, also towards the kidney yin deficiency, we can use 六味地黄丸. Actually, 六味地黄丸 is actually very popular, but you can see that it's also good for constipation, even here. In China, I use 六味地黄丸, not like here. Here, I think that's a kind of a little bit different of the body constitution, but I think I can see that only 六味地黄丸, some of patients even have diarrhea. So it's very good also. It's safe because it's this formula usually for the kids, right? Okay, then let's see the pattern 3. The pattern 3, that's lung and spleen qi deficiency. So you can, from the tongue, you can see that's the tongue is puffy. That's the teeth mark and the coating, right? Yeah, so this kind of patients actually always have like pale, low energy, right? Poor appetite sometimes, sometimes have like swollen, something like this, like have dampness. So we, according to the patients, if that's for the like lung side or for the spleen side, usually it's for the spleen side. So we will choose 补中益气汤. 补中益气汤, that's from the middle jaw to rebuild the ecosystem. It's also very good. And also if some of the patient have like a heavy thin coating, we may add 二陈汤, 半夏陈皮 for that. So that's where we have like more like movement for the patient, not only nourish, right? So this is the formula I usually use for the qi deficiency. Some of the patient also maybe towards the yang deficiency. So let's see the yang deficiency. If the patient have yang deficiency, patient always feel cold. Some patients may be lack of the menstrual, poor appetite, and low energy, depression. Some have the like Hashimoto. Some patient has like thyroid issues. Yeah, adrenal fatigue. Yeah. So if from the tongue you can see the pale, very sliding and coating, dampness, teeth mark, right? So this is actually very typical yang deficiency patients. Why? Because these patients use the laxative for many years. So there are a very good formula for this kind of patients. 济川煎. 济川煎 is warm the kidneys, nourish the blood, strengthen the kidney gene, and also for moisture the intestine, unblock the bowels. That's very important that we use that's 肉苁蓉, because the 肉苁蓉 is for the warm kidney yang, but for the kidney yang, it's not like very dry. So it's like very nourish. So this kind of herbs, it's very good for the old patient because they can't have like very strong laxative. They can't tolerate that. It's also for dangui, good, niuxi, that's all for the blood stasis, right? So this formula, I usually use that, very popular in China. But if that's not sufficient, maybe sometimes I will modify, add foods, 肉桂, 干姜 for very severe patients. Okay, then let's see another pattern. That pattern, patient have yang and yin deficiency of kidney. So like more severe than the yang deficiency side. Or even some patient, if we give them the herbs, then later they will have these patterns, like yang and yin deficiency from the yang deficiency, because they also lack of the yin. So like this kind of patient, if for the females, even the males, we also can use the herbs for 二仙汤. That's also this formula actually from the beginning for the fertility. But we use this for constipation. So this formula, we can nourish the kidney yin and yang, tonify kidney jing, and also for the fire deficiency. Also for regulate the Chong and Ren meridian. So I can tell you some of my patients, actually, they have the constipation, that after they recover from the constipation, they get pregnant. Because of that, patient feel very surprised. That's the second baby about that. So I use that for the constipation. Yeah, for some like fertility also. That's a very good formula. Then above that, because we're target the chronic constipation, so most of the patients actually they have the deficiency, but with the deficiency, they actually have other things combined together. So we have to know that there are three things. One is dampness and heat. So if for the with the dampness and heat, we have to spread qi, facilitate qi, clear the damp and heat from upper, middle, and lower jaw. So 三人汤 is a very good formula from upper, 杏仁, middle, and lower, right? So 杏仁, 豆蔻仁, 薏仁, that's three like seeds, right? But that's for the very good for the like clear the damp heat. So if the patient you want to use the 六味地黄丸, but the result is not good because she or he also have dampness. So we have to use the 三人汤 first. If the coding is clear, then we can use the nourish things. Yeah, so we can combine or modify this just according to what we're thinking, how much percentage of these things in the patient body. The second thing, that's blood stasis. You can see this tongue, that's a dark, right? Purple, dark, and also with coating. So, but the patient don't feel any like cold, that's not the yang deficiency with the blood stagnation. It's just the blood stasis and with like coating, with dampness. So like this kind of patient, we can use 血府逐一汤, because for the blood stasis, that's 川芎, that's 桃仁, 红花, 当归, these are also very good for constipation, that's motility. Give you some examples, like I have a patient, I just give, because he has the like stroke, then I give him 补阳还五汤. So because there are some herbs for the blood stasis, right? So the patient have severe diarrhea. So like these kind of things, you have to know that if you use that, you have to tell the patient. If the patient no constipation, you have to tell them, oh, maybe after these herbs, you may have some diarrhea. But if the patient has a constipation, okay, good. We can treat the constipation. That's for the 血府逐一汤. So this is also good for that. We also have like similar, we have 承气汤, right? 调和承气汤, 大承气汤, 小承气汤, 调味承气汤, right? 增液承气汤, 调和承气汤. Yeah, so many 承气汤, right? 承气汤, it's 大黄, like rhubarb, right? Later I will say like why we not very popular use for the chronic constipation. Okay, then the last pattern is like patient have some excess heat and body fluid loss, like heat, right? But we not use the 承气汤. Usually we use 黄连上清丸. It's a mild, it's not very strong. It can, because it's a pills, right? It's not like a tongue like decoction, so strong. So usually we use 黄连上清丸. That also have like 黄连、黄芩、黄柏、栀子、大黄, but that's a different how to say, not so severe. And also have some other things to clear the dampness. And also for nourish the yin, like have the 天花粉 for nourish the yin, right? 葛根 for nourish the yin, right? So these are 黄连上清丸. I think that's better for chronic constipation for this pattern, that's excess heat and body fluid loss. Okay. Then let's say something about. If you have any questions, you just ask me, rightly, I can ask you about that. So then let's move to safety consideration and precaution. That's something, how to say, I want to share with you. As I mentioned before, that's some of the herbs, not all the herbs for chronic constipation is safe, especially some like 大黄、芦荟、牵牛子、何首乌、决明子、番泻叶. 番泻叶, that's the senna. I have seen that's very popular in like OTC, like war screen, right? War screen, that's popular. So why? Because this kind of laxatives is commonly used in constipation. It's very cheap and the results is very good. But if used long term, it will lead to very complex chronic motility issues, which is catalytic colon, and have destroyed the nerves of the colon. So it's like neuropsy. Later I'll show you. Okay, let's see these pictures. Like this is a normal picture from colonoscopy. Normal. You see this very clear. The color, that's you can see the blood vessel very clear, right? The second photo, that's for like after use the laxative. We call it catalytic colon. You can see this kind of like black and white, right? Some color. But if you quit that herbal medication, the color will disappear. But some of the patients, the results, that's their function, can't recover very well. It's because it's like neuropsy. Okay, if for the severe, you see, we can see this is a black. Like this is the patient use the herbs, like use the 大黄、芦荟, different things by herself for more than 20 years. And when they see us, when she come to me, that's she actually every day have to use the enema. So if we use the like colonoscopy, we can see. Then we think, oh, maybe the colonoscopy is broken because we can't see anything. It's so black, right? Actually, this is like from the herbs. So we have to be very careful of that if we use that for long term. So that's why from the beginning, we have to quit this from the beginning to recover their function. This is some research I did, because if we use the acupuncture, use the herbs to do the research, right? We have to use the rat model. How can we do the rat model? The rat constipation model induced by the rhubarb, by 大黄. So we can see from this picture, this is a normal. This, you see, that's the color. The color is a neuron marker in the internerve system. So it's very good. And also the muscle, you see the muscle, the longitude, right? The attitude. So it's normal. But after we use this is a constipation model. You can see the color and also the muscle is broken, right? So this is actually our research for use the laxative, have the ENS neuropsy. Where is the nerves? you can see this is like the gut, the colon. If that's a colon, right? The colon, that's the ENS, that's in the submucosal plasticity. So if we use the stimulus laxative, that's where it give you like diarrhea, right? Because it stimulate that have the sensation, then have a lot of liquid in your lumen. And also, this is a related sensation. So if you use the laxative more, then your bowel sensation will less. So little by little, you will have no sensation to go. This is one thing because that's destroy these nerves here. The second nerves, that's the layers contest the neurons for the like the muscle. So this is for the motility. Little by little, this will destroy the muscle, destroy these nerves here, the second layer. So this is for the motility. So that's why if you use the laxative more, it destroys these nerves. So that's where have the low like motility. So if the patient has the sensation, but you still use the laxative, so the patient will have like the one, firstly have the pelvic floor issues. Then if because of they use the laxative overused, then we'll have the motility issue. So that's where it be combined together. So that's kind of, we have the caution of the how to safely use the herbs, right? From the beginning, okay?
Is there a max amount of time for, say, like the senna that you would use, or does that depend on the patient?
Yeah, so we have the research about how long if we use the senna to destroy, right? Destroy the nerves. Usually after 3 months. Yeah. So it's kind of little by little. So that's why patient need more and more, right? Have the additive because the body gets used to need more, right? Yeah. So is it like answer your question?
Yeah, thank you.
Yeah. So if we quit that, we use the herbs to meet the gap. Actually, that's very difficult from the beginning. Patient may feel like very miserable because they don't have the confidence to quit that. Yeah. Okay, then so we have to prevent not overuse the laxative, right? Firstly, we can use the food therapy for mild constipation. We can use some fruits, for example, like kiwi, right? Banana, like apple. These are for like fiber, right? Because the fiber, that will be good for bacteria lining things. And also we can use some flower tea. Actually, some flower tea, that's also good for motility. Yeah. And some of the patients, for example, like me, I like congee in the diet because it's easy. For example, like for the breakfast, I put everything, for example, like shangyao, jujube, right? Like some kind of chias, whatever, fiber, something, even like guiyuan. Yeah, so these kind of things we can put all together, then with some like with congee. So it's easy in the morning, right? Because in the morning when you have that, warm that, then you will have the like reflex, like gut brain reflex, to have the bowel movement sensation. Yeah, to have good appetite, a good habit. Okay, last thing, I would give you some advice about honey suppositories. Do you remember honey suppository? Actually, that's very easy, but actually that's very powerful, especially for elder patient, for kids, for pregnant women, because it's just a nourish, but actually it's like a key to stimulate from the rectum, but not very strong to have the bowel movement. So usually for the patient, if we meet the gap, we have to firstly orally, then we have to use that to wake up the system. And every day in the same time to have the like regulate the habit. So this honey suppository, that's I handmade as a natural remedy for my patients. This is Actually, that's an 1800 years old Chinese medicine text of Shanghan, right? Shanghan Lun from Zhang Zhongjing. So this is a like Dao, right? 密煎导. So you can use that actually. I use this for the use the organic like honey. Then just to do that. Yeah, if you're interested, I can show you some picture how I do that. Yes, for my patient. Okay, finally, let's see a case study so can give you some information about how to use that. This is a very difficult patient, a male, 52, constipation for 18 years. He actually has a motility issue, have like infrequent bowel movement. So he has like 6 to 7 medication for constipation at the same time. Even that, he has seepage from the impaction of the rectum. Even that, he still has bowel movement every 4 or 5 days. So it's very miserable. He even several times went to ER because of the like intestine blockage. So no idea. He has a very complex of history, has like mental issue, OCD. So he also has like 6 kinds of mental medication, make he sleeping calm, can't like reduce the dosage. So that's also the side effect from the medication, right? And he also has the hypertension and diabetes, type 1 diabetes. So you see, there are so many things actually contribute his constipation. But he can't have the operation. And he has a very high dosage already for the laxative. So he referred from like a specialist come to see me to try use the herbs or use the acupuncture to treat that. From the tongue, we can see, you see, this is like a small and thin coating, red tip. His pulse is soft and shaking because he is still have very high stressful and with the medication, so he always has shaking from the medication. Okay, so firstly, I gave him enema for 1 week every day because we need to clear the impaction. That's very good. Then we move to honey suppository. Every day use a honey suppository because we have to build the good feedback for the brain, have the sensation at the same time. It's also good. And also at the same time, I use 六味地黄丸 with 柴胡疏肝散 together because he has like long-term have the medication, have the iron deficiency, and also have the mental issue. He has very high stressful. So we have to give them some motility things like 柴胡疏肝散 help him. And also give him acupuncture. But from the beginning, he never has acupuncture. So I can only have very tiny needles. He was very scared. So how can we like meet the gap? That's the herbs. Yeah. Then little by little, we see the results from the acupuncture, even with the moxibustion. After 10 sessions, he quit all the laxative. His mother said that's a miracle, and also his mental things that's much better, more alert, even reduce the medication from the mental health. Yeah. So until 20 sessions, he can have bowel movement spontaneously without any laxative and also without herbs. So right now, he almost has normal bowel movement. Sometimes he has the good bowel movement. Sometimes maybe he need just 1 honey suppository. So he is very surprised and very happy to have that. He also continue come to see me like every 2 weeks because he have other things, and he also found that acupuncture help him for the mental issue. Yeah. So that's a case study. Okay. Take home message. Let's move to the like very important things today. We will cover chronic constipation is a common and undertreated issues right now. So actually need a lot of education for the patient, even for Western medicine doctor, actually. And we need know how to use the TCM diagnosis, how to figure out what's the baseline of the patient from the body constitution. We can from tongue, from ask the question, also palpate, touching the abdomen, whatever, to get our data. And we can also observe the tongue changing to modify, to feedback, to change the herbs. Just now, I give you these kind of patterns. These are already have the mixed. That's a very common patterns. We usually can see that. But some complex patient maybe have like 2 patterns together, right? Yeah, so we have to think about that, how to modify the herbs. And herbal medicine actually has multi-targets, tailor the patient's needs. So it's not like just one receptor for that, just one kind of target for the medication. So let's see the mechanism. The mechanism actually that's for the brain-gut axis. Change the microenvironment. It's like whole person holistically regulation our internal environment to reduce the inflammation. So when you treat the constipation, it's like a key for your body to recover your self-healing system. So you can see your energy, your sleeping, your mood at the same time can recover, can be better. So it's very good for quality of life. It's a different as a Western medication. So from this point of view, I think that's have some advantages over the Western medication. And it's also the alternative options for patients have no result from the medication, because some of the patients, they can't tolerate the Western medicine medication because of a side effect from the heart, some severe diarrhea, and some vomiting and other things like side effect. But we have to know that herbs, usually it's safe. But we have to know that if long-term use some kind of herbs, we have to be very careful, because that will make your colon neuropathy. At that age, at that stage, the treatment will be very difficult. So we have to think about that's 大黄、芦荟、牵牛子、何首乌、决明子、番泻叶、senna. Okay, yeah. Okay, thank you, everyone. And if you have any questions, you can ask. Yeah, thank you. Any questions? 麻子仁丸, yeah, 麻子仁丸, yes. 麻子仁丸, it's usually especially for the old patients, right? For the old patients, that's good. But as I said, not used long term, because in 麻子仁丸there also have 大黄. Yeah. Okay. Okay, thank you, everyone. Yeah.